Hey everyone, thanks for tuning in and welcome to Quick Tips. Steven here with Team Euphoric, and this week we're going to be going over 3 exercises to help decrease your low back, hip, and knee pain and improve your posture. A couple days ago, we discussed how a lot of people have low back and hip and knee pain and how it stems from dysfunction in the lumbopelvifemoral complex, and how one of those common postural faults is going to be excessive anteversion of the pelvis or an anterior pelvic tilt. And we ended up focusing on strengthening the lower abdominals. So now that we've reinforced the pelvis from the front, we're going to start to reinforce it from behind by focusing on the strengthening exercise for the deep fibers of the gluteus maximus muscle. The gluteus maximus, it attaches to the posterior iliac crest, and as that muscle shortens and becomes stronger, what's going to happen is it is going to drive the posterior iliac crest down toward the ground, which is going to bring us into more of a retroverted pelvis or a posterior pelvic tilt. And the way that we're going to perform the exercise, there's going to be 4 different variations, and we're going to be targeting the glute max from the lateralmost fibers all the way to the medialmost. So if we were to break it down into four different parts, we have the lateral fibers, the medial lateral fibers, the medial lateral fibers, and the medial fibers closest to the midline. For all of them, the movement pattern is going to be essentially the exact same. The only thing that's going to change is the foot and knee position, but we're going to be in a supine position, meaning we're laying down on our back. With our arms, we want our hands at the level of the glenohumeral angle. If you're not sure where that is, your palms are roughly going to be at the level of your forehead. Then you're going to flex your hips and knees to 90 degrees and make sure your spine is nice and flat toward the ground. You're going to place your feet on the floor, and then for this first position right over here, what we want to do to target the lateral fibers is we're going to have our knees together and our feet apart, and we want to make sure that our knees remain in contact with one another the entire time. We're going to go into retroversion of the pelvis by rounding the pelvis and going into that posterior pelvic tilt, and then 1 vertebra at a time up to the level of the L1. We're going to go up toward the sky and then unroll the spine back down toward the ground. Then, if we want to target the medial lateral fibers, what we are going to do is we are going to bring the feet together. So we have the feet together, knees together, and the principle is the exact same. We're going to go into retroversion of the pelvis, round the spine 1 vertebra at a time to the level of the L1, and then unround it so that we go back to the starting position. To target more of the lateral medial fibers, what we're going to do is feet apart, knees apart, and this is going to be the typical hip bridge that you see most people doing in the gym. Retroversion of the pelvis, and then again, 1 vertebra at a time, we're going to raise the lumbar spine up toward the sky, and then unroll the spine back down toward the ground. And then the final position for the medial fibers are the ones closest to the midline. We're going to bring the feet together, and then we want to separate the knees as far apart as possible without allowing the medial arch to come up off the ground. So we want to maintain a nice flat arch and maintain that contact with the ground. Principle, same thing. We are going into retroversion of the pelvis, rounding the spine 1 vertebra at a time to the level of L1, and then we are going to unround the spine and come back toward the starting position. But those are the 4 different positions for the deep fibers of the gluteus maximus muscle. Give each one a try, and to really strengthen it, you want to be sure that you're doing 3 sets of 50 repetitions. In a couple days, we're going to be focusing on another strengthening exercise to help balance out the pelvis, and it's going to be for the proximal fibers of the hamstring group.